I'm not gonna lie, I did have the aspect of it'll never happen to me. But it did, and I'm living with it every day. I am HIV positive. It's basically the beginning stage of HIV and AIDS. The way I found out, I was donating plasma at the time, and they called me and told me that I was HIV positive. My ex that I was with had it and had not told me. So it was hard to deal with. It's been very hard to deal with, actually. Whenever I first found out, I went into suicidal mode. I didn't want to live. I didn't want to have to be able to tell everybody that I was possibly going to be partners with that I have this disease, and want to face the rejection, because people misjudge. And they judge people on the disease and not for who they are.
In Columbia, we have about 210 people living with HIV as of the most recent data, which is 2010 numbers. And in the region, we have over 400 people. In the 33 counties that we cover, we have over 400 people living with HIV or AIDS right now. When it comes to diseases like chlamydia and gonorrhea, we see a lot more of those numbers. Over 1,800 cases of chlamydia last year in our 33 counties, with a large majority of those focused here in Boone County.
We have funding that comes to our health department. It's federal funding given to the state of Missouri, and we then contract with the state of Missouri to provide testing for HIV. We're also focusing a little bit on syphilis, but really the main goal is HIV, and we pick up a couple of things along the way. And through that particular program, we're saying, okay, a lot of people are coming to the health department, they're going to their doctor's offices to be tested for HIV as part of their health care, but some people aren't. Some people aren't necessarily thinking about it as an issue. So let's get out in the community where we know there may be people who are at risk for HIV and hadn't really given it a lot of thought. And so we'll do some education along the way and provide testing right where people are located.
We see individuals that we've seen several times, and they've kind of become standard testers, which is great. We want people to be tested regularly if they're active and putting themselves at risk. And so they come into the office or they see us outreach events and are seeking out testing. We also have individuals that actively avoid testing for various reasons. They're afraid of the results, they don't want to know what's going on, or they don't want to admit that they could have put themselves at risk. So it's up to us to really get out there and do the education and kind of normalize the testing and the conversation about risk reduction to make it something that's easier and more palatable for people to deal with.
For the contract, we service a 33 county region. A lot of the counties we service then are extremely rural and don't have a ton of people living there relative to Columbia, or don't have a lot of new HIV infections relative to Columbia. So we do still spend a lot of our time in Columbia and in Cole County and Jefferson City. And then we do an event here and there in some other communities around the north central part of the state.
We have several different testing options. We have walk-in testing Monday morning and Thursday afternoon, and appointments Monday afternoon and Thursday morning for free HIV and syphilis tests. And they can make appointments with Dana and me for those tests, or walk into the clinic Monday morning or Thursday afternoons. We also do appointments as needed. People can call and make appointments if they can't make it to one of those 2 days. We can do HIV testing through a couple different methods. For people that are really skittish about blood or hate finger sticks, we can do an oral test. We can also do a rapid HIV test, which is a finger stick with just a drop of blood, and we'll have results for that in about 15 minutes. And we can also do the standard blood test for HIV with the results in about 2 weeks.
We have a STD clinic on Tuesday nights, and it's low cost. It's $10 for people who live in Boone County. If you live out of the county, it's $20. And you can walk in. I recommend you show up early, but it's basically from 5 to 7. When someone comes to the clinic, they're going to see a nurse practitioner or a physician, and we actually do everything. We interview them. We're kind of like a social worker. We also do the medical part. We do the lab. So we do everything. When they come in, we would actually do an exam. We'd look at the genitalia of the male and the female. So you are going to get looked at, and we test you for chlamydia, gonorrhea, HIV and syphilis, trick, yeast, and there's other blood tests that we can do that are extra, but we can do them. We can check for herpes, hepatitis B, warts. If you have any kind of symptoms, please don't sit on that. But with STDs, they can be totally silent, and that's where people go wrong. They think, I'm not feeling anything, there's nothing going on. So don't gamble with that. Just if you've been having some high-risk behavior, which is having more than one lover, then you really need to get checked out.
HIV in a lot of ways, this year's the 30th anniversary of us recognizing that this was recognizing HIV for what it is. And so it's been a little more in the news and a little more on the radar screen, but in a lot of ways we don't hear as much about HIV as we did maybe 10 or 15 years ago. And it's a problem that hasn't gone away, and we work on it day in and day out. We have new cases in our community every single year. So it's something for people to keep in mind and seek HIV testing as part of their regular health care, and take measures to protect themselves from the disease as well.
I contracted it, they believe, in March of last year. I was pregnant in February and had a miscarriage in August. So my life has not been the easiest emotionally, and dealing with basically having a miscarriage and possibly due to my HIV. And I wonder every day, am I going to be able to have kids? Am I going to be able to be in a normal relationship with someone and then be okay with it? And it's kind of hard to cope with.